So I'd like to welcome everybody. Thank you for being here for the first of our 2021 Resilience Symposium webinar series. This is based on what it seemed like the overwhelming success of what we had in 2020 over the course of 3 days with leading experts from all over the world, both in policing and neuroscience, psychology, and the world of resilience. We want to take that and push it forward. And the mindset of this webinar series is in line with the symposium, making it free, because everything that everybody's experiencing, especially budget cuts and the inability to travel, we don't want to hinder anybody's opportunity to learn more. And I think for today, what we have lined up for everybody, I think it's a really important topic given everything going on in the world in policing and beyond. And if you're here outside the world of policing, in the first responder field, or even frontline workers, or anything beyond, I think what Dr. Kamcar is going to share with you and our panelists, I think is relevant, yes, specifically in policing, but well beyond that. And the last thing I will just say is any comments or questions, please at any point, put them in the chat box, throw it in the Q&A, because the last thing I will say is for this webinar series, we want to make it truly different in the sense of not just a presentation for the 59 minutes. We really, truly want to make this interactive. And that's why we have the presentation portion on the early beginning, but we also invited our 3 esteemed panelists to share their thoughts and perspectives as well to make it truly a conversation. If anybody interested in the background on our presenters, I encourage you to go to the resilienceSymposium.org website where you can learn more about them. But briefly, the introduction I will do for all of you right now is just very brief. And again, I encourage people to learn more about our presenters. But first, our key presenter, Dr. Katy Kamcar, is a clinical psychologist for the Center of Addiction and Mental Health. She's also an assistant professor in the Department of Psychiatry, at the University of Toronto. Then our 3 panelists for today is first Dr. John Mann. He's a Paul Jansen Professor of Translational Neuroscience at Columbia University Irving Medical Center. He's also the Director of the Molecular Imaging and Neuropathology Division at the New York State Psychiatric Institute. As a sidebar, which when I introduce myself, I also am very fortunate to work under Dr. Mann. Dr. Mann, the joke I always say, I don't know if you use it ever, is I don't know how you fit that on a business card. I haven't been able to yet, but I'm open to your ideas and suggestions. Then we have the incredible, awesome Chief Dale Mcvay, 26 years in policing. He's currently the chief of Edmonton Police Service. He was also with Prince Albert in Saskatchewan. Also, he's worked in corrections. He was the past president of the Canadian Association of Chiefs of Police. And then our final panelist is also Sherry Martin, who has a distinguished career in law enforcement as well as academia. And importantly, she is currently the National Director of Wellness for the Fraternal Order of Police. Myself, briefly, I am Jeff Thompson. I will be facilitating today's conversation. I'm a detective and the mental health and wellness coordinator with the New York City Police Department. I'm also very fortunate to be an adjunct associate research scientist working under Dr. Mann at Columbia Psychiatry. And today's event is being co-hosted by the NYPD's Health and Wellness section and Columbia's Department of Psychiatry. This is the most you will hear me speak today. Importantly, we are all here to hear from our presenter and panelists. So Dr. Kamcar, I'm going to send it over to you again, sharing some information importantly on the topic of moral injury. It is all yours.
That is wonderful. Thank you so much for having me. And what an honor to be here with all of you and with such an incredible panel. And yes, such an important topic. And when we talk about really moral distress, moral suffering, moral injury, I think it is always important to have an appreciation of the context. And I always find that to have an understanding of one element, we do need to put it in its basket. So I'm going to first talk here very briefly, and I know we're going to touch on some other elements. One thing that I always like to touch base on at the very beginning is really when we talk about prevention. There's a lot of misunderstanding around prevention, and it works on a continuum. There's a prevention continuum of care, same whenever we talk about physical illnesses. So we have primary prevention is anything that we do prior to an onset of an illness. So when we talk about, even right now, essentially, we are working on this primary prevention. So raising awareness, education, building health resiliency, reducing risk factors, building protective factors. Secondary prevention, symptoms could be mild to moderate, or there's an acute stress going on. Nevertheless, we do need to address it prior to the problems worsening, sometimes peer support, evidence-based treatment, or any type of problem solving that might need it. Keeping in mind that any prevention measures, interventions that we want to engage in need to be adopted at both individual level and organizational level. Then we have tertiary prevention. So as my work as a clinician, it's very much, this is my line of work. So here the symptoms could be moderate to severe, there's disability management, evidence-based treatment, work accommodations, return to work collaborative care model. And of course, when we talk here about moral injury, is involved actually throughout all the primary, secondary, tertiary, we can definitely see elements of moral injury, and certainly at the tertiary level of care. One of the most well-researched, evidence-based here, and continues to be used in organizations and well-researched, the work stress model, and the most well-known one is the demand control model by D. Karasik in 1979. So first of all, one of the key definitions of how we define stress is when the job requirements do not match our capabilities, resources, and needs. And sure enough, this was taken by Karasik in 1979, who looked at, and again continues to be used, is the most well-known job stress model, looked at the interaction between work demands, so our work responsibilities and duties, and work control. So to what extent do I perceive I have control over the demands? To what extent do I perceive that I have training, resources, education to be able to take care of my demands? Again, I'm not going to go into detail about this model given the limited time, but what I would like to emphasize is, of course, as we know, when the demands are high and we don't perceive ourselves as having enough control, it leads to high job strain. And it is a high job strain over a prolonged period of time that does increase the risk for burnout, medical problems, psychological risk difficulties. One thing that I would like to point out, and again supported by actually very recent research and systematic reviews, is there's always about the debate about what is most important. Is it for us to have, to be able to manage our work demands? Is it more important for us to perceive that we have control over the demands? Or is it more the balance between the demand and control? Actually, all of those elements have been found to be important, all of them. But there is a little glitch here, in that is when we talk about balance between demand and control, because what we are seeing is that continuously increasing the demands, but then also increasing, let's say, resources and support up to a certain point is not a balance anymore, right? Because a person cannot keep up with the demands any longer, even though you might provide the person with maximum support and training education. After a while, we're not going to be able to keep up with the demands anymore. So excessive workload has chronically been found to be leading to tremendous amount of strain and stress, and increasing the risk for psychological and medical conditions, but also, once again, elements of moral injury, which I'm going to talk about in a minute, definitely included here. Systematic reviews in terms of what are some of the key stressors within organizations we need to know. This is true not only for policing, but also actually true for a variety of organizations. Are so stressors intrinsic to our job, our role within the organization, especially if we perceive there is ambiguity within our role, or we feel that our roles do not match our training, our interests. Once again, elements of moral injury throughout all the stressors here. Rewards, especially if we feel there is an imbalance between the effort that we put in and then also the rewards, so feeling maybe not appreciated or feeling the opportunities are limited. Supervisory relationship, especially immediate, a relationship with the immediate supervisor has always been found to, again, being a protective factor or a risk factor. And of course, some organizational structure and climate. All of those here that I talked about, once again, they are part here of a moral injury, which I'm going to address today. In terms of policing here, as we know, there's not only exposure to traumatic events, but there is also exposure to what we call occupational stressors. And as part of occupational stressors, we have operational stressors, so fatigue, pain, injuries, shift work, but we also have organizational stressors, the policies, leadership style, management, staff shortage, limited resources. As to why we do need to know this is that it is not only traumatic events that are contributors to mental health conditions, including operational stress injuries and post-traumatic stress disorder, but one thing we do know is that after controlling for traumatic events, occupational stressors, so both organizational stressors and operational stressors, are single significant contributors to mental health conditions, including post-traumatic stress disorder. Two organizational stressors with the strongest mental health impact have been found to be the perception that one needs to prove value to the organization, and the other one that they believe that if one is ill, my coworkers are going to look down on me. In terms of operational stressors, the two associated with the highest mental health impact are fatigue, and again, the same thing about difficulty managing work and life balance. So anytime we question our decision-making or our ability to prevent what happened in line of duty, anytime we believe we did not do the right thing, did I do enough? I question myself. Or this internal tension within the self about maybe I was prevented from doing what I felt was morally right, can set the stage for moral distress, moral suffering, moral injury. A betrayal of what is right by the self or others can again set the stage for moral injury. So any event, action or inaction that might transgress here are moral values, ethical beliefs, our standards, expectations, can lead to what we call moral injury. So when we talk again continuously about traumatic events can lead to trauma reactions that are, as we know, fear-based. So the fear for my safety, the fear for others, the fear of impending doom, something bad can happen. But also there are trauma reactions that could lead to what we call our loss-based. This is especially if we had to deal with death of a colleague, suicides, dealing with traumatic events that were fatal, children who died. But now there is also here the traumatic reactions that are moral injury based. So examples, so here I put a link that I have written for the public. So in terms of more of the symptoms related to moral injury. Examples of events that could increase the risk for moral injury. So examples, unintentional errors leading to injury or death, witnessing or failing to prevent harm or death, failing to protect the public, the transgression of peers or leaders, betrayed our moral beliefs, witnessing catastrophic events, etc., etc. One thing here also, again, within the policing is there is already an inherent level of moral injury that it's inevitable. There is, on the one hand, the duty to serve and to protect, and also on the other hand, that sometimes the duty to serve and to protect and to care might involve shooting. So it already introduces this inner conflict that is already there. Not all events that are moral injurious are going to be distressing, but we need to appreciate once again the context, the accumulation, the support that might have been available or not. So all of those key elements that can make it again increase the vulnerability and the inner conflict. We just talked about organizational stressors. So organizational stressors, yes, can increase the risk for moral distress. We talked about already, so for example, heavy workloads that we feel that we're not able to manage anymore, job demands exceeding our capacity to cope, limited resources, making mistakes, but then also when we feel that we have been part of systemic failure, injustice, or blame going on. So a variety of examples of organizational stressors we want to appreciate. I wanted to give two examples here, but I also know here my time is limited and there are some other key elements I want to talk about moral injury. Chief Mcvay, am I doing okay in terms of my timing here? I know you have, thank you so much. Thank you for that relief. So two examples here. A patrol officer and his partner respond to a domestic violence call. The officer's partner is physically injured while attempting to subdue the perpetrator. The unharmed officer follows the operational protocol he learned during training on domestic violence cases and takes reasonable, defensible action. Nevertheless, because of the negative outcome, harm to his partner, the officer cannot shake the guilt he feels for not doing enough to prevent what happened to his partner. Because of this moral distress, in the future, he may try to avoid responding to similar calls, or he may act in a hyper-aggressive manner to prevent a similar outcome. This was within one of our published studies on moral injury. Moral injury that sometimes feeds our anger. Everyone around you is treating you like a hero for having the courage to do what you had to do. Outwardly, you show appreciation for the supportive comments, but inwardly, you feel emotionally broken. And this is by retired York Regional Police Staff Sergeant Brad Mcvay and retired Ottawa Police Service Staff Sergeant Cedric Gravel. And it is not only within our article, but also in the remarkable work in providing peer support and the Walk the Talk book. And I'm always so honored to say they are my dearest and nearest close friends. We can talk continuously about some of the key symptoms, but as we see, they're very similar to the symptoms of post-traumatic stress disorder, and which we're going to talk about in a minute. But what I would like to point out, while we continuously talk about fear and anxiety as common emotions, when we talk about moral injury, the most common and disabling and paralyzing emotions are guilt and shame. Guilt and shame are private emotions, are self-conscious emotions. Anxiety and fear are targeted towards external targets. Guilt and shame are targeted, are private, self-conscious emotions. When there's negative evaluation of the self. When there's guilt, there's negative evaluation of the behaviors, and it shatters the self. It shatters our perception, our concept of self. And we use that shattered self, the belief system about the self, others, and the world that becomes shattered. Then we use again that shattered belief system to interpret future events. So you can then again imagine here is compounding the distress, is compounding the disability, our decision making, and so on. So more often than not, again, in my therapy sessions, especially around difficulty of returning to work, the isolation, feeling withdrawn, the shame or the embarrassment, even talking to colleagues, it's not only the trauma and PTSD, but it is a moral injury that we want to keep in mind that is absolutely paralyzing and becomes the strongest barrier. The symptoms, again, of moral injury are very resembling the symptoms of post-traumatic disorder, but the mechanisms are very different. In trauma, is the fear for safety. In moral injury, is the betrayal of what is right by the self or by others. We also have here, as I mentioned, the shattered sense of self, the self-compassion, self-acceptance. PTSD and moral injury are separate constructs. Even the MRI studies, the fMRI studies have shown that moral injury, while often coexistent with PTSD, is not fear-based. Finally, here again, many things I want to talk about, but I'm going to stop here after this so that we can have our panel discussions. Here is a study I had the honor to be part of here. Here is a sample of law enforcement officers from the National Police of Finland, 370 here. What we wanted to look, again, we need to talk as well today about compassion fatigue and burnout. Key constructs also related, different, but related to moral injury. And when there is a risk of moral injury, there is a compounding risk of compassion fatigue and burnout, and vice versa as well. We looked at the contribution of moral injury, but also a compassion fatigue and how they predict PTSD. We did find that moral injury is a significant predictor of PTSD and of its diagnostic clusters: avoidance, hyperarousal, and re-experiencing symptom clusters. We use the DSM-4 manual, not the DSM-5, and that is why we only have the 3 cluster of symptoms. What we have found is that both moral injury and compassion fatigue are both unique and significant predictors of PTSD and of the diagnostic cluster of symptoms. But what I would like us to pay attention to here is this: the 2 predictors accounted for 44% of the variance of re-experiencing symptoms of trauma, close to 47% of the variance of avoidance symptoms of trauma, and 45% of the variance of the hyperarousal symptoms of trauma. So what that means is that we cannot always talk about potential traumatic events, but we also need to talk about exposure to potential morally injurious events. And of course, compassion fatigue and also other key elements, burnout, when we talk about operational stress injuries or any workplace mental health occupational stress injuries when we talk about policing. So I'm going to stop here for now, otherwise I can talk, as Chief Mcvay would say, for another 10 hours. Thank you so much.
Thank you, Dr. Kamcar. And again, looking at it as the flow of conversation, just slightly adjusting what I had scheduled. I saw one quick question that came from the audience regarding your study there. Gabrielle asked, in this study, how much of the variance in PTSD was explained by moral injury alone? Would you be able to answer that?
I will have to look at it, and I will definitely get it back. But we do know very strong one. When we looked at the role of moral injury, we did control for compassion fatigue. So it was a unique predictor, but compassion fatigue was also a unique predictor as well.
Great, thank you. And before we jump to our panelists, let's just take one more question from the audience. And it was from Deputy Inspector Mark Wachter. He's the commanding officer of the Health and Wellness section at the NYPD. He asks you, Dr. Kamcar, is there a time frame when moral injury can be most present? And he adds, I've seen triggering events in the world have brought up past incidents for colleagues.
I believe the answer to this question is probably around we don't know and maybe no, although it's an excellent question. I think that yes, in terms of accumulation doesn't matter in the context of operational stressors, organizational stressors, accumulation of trauma. We do know it creates, we can go from proactive resilience to reactive resilience. Our tolerance goes down, vulnerability goes up. We also talking about in terms of, again, as I mentioned, the compassion fatigue and the burnout, but the wear and tear of the immune system as well. But that is also the reason why we want to talk about moral injury right from the police training, because that inner conflict might onset again at any time, and over time gets worse and worse, especially if we're not able to address in a safe environment this inner conflict.
Yeah, thank you. And, you know, one thing that comes up to my mind, and I'm just putting it out there for you and the rest of the panelists, how important perspective is, and the idea of how, for me at least, moral injury in the subjectiveness, perhaps it is, but just something I wanted to put out there. Now we're going to jump in and get some comments from our expert all-star panelists. And Dr. Mann, you're up first. One question I'd like to throw to you, and again, jump in with whatever you want to share, but given seriously your global expertise in suicide and suicide prevention and postvention, one of the things that I was thinking of is the connection, or is there a connection between moral injury and perhaps suicidal ideation, or even depression, anxiety, or I'll throw that at you and take it anywhere you want, Dr. Mann. Thank you.
Thanks very much, Jeff. That was Katy, that was a fantastic talk. The perspective that I have on this is that one of the reasons that there's a relationship between moral injury and PTSD, and I'm going to tie that into suicide risk, is that that they share the kind of relatively dramatic, overwhelming single event that acts as the trigger, and so that the same event that may trigger PTSD may also create the moral injury. so that and they have similarities in terms of of their symptomatology, and therefore part of the overlap. It's not that moral injury creates some kind of unique injury in the brain, and then that leads also to PTSD. It's that they may share a common cause, and in terms of PTSD, we already know that there's a very significant elevation of suicide risk. There's also an overlap between PTSD, as you know. Some events trigger PTSD, some events trigger an episode of major depression, and some events trigger both. And you could sort of add to that list, some events trigger PTSD, major depressive episodes, and moral injury. But at least in terms of PTSD and depression, we know that suicidal behavior, it can be an outcome of those. And we know less about that in terms of moral injury, although the data is building up because individuals will talk about the fact that they crossed some line in some sort of red line for them, wherever that is for them. And now they're suffering from this combination of depression, blame, shame, anger at their supervisor, their trainees, their support system, their job that put them in that situation to begin with. Actually, if you want to see moral injury and PTSD playing out in front of your very eyes, just watch what's going on in the Senate over the last few days. That's a perfect example. But we see moral injury creeping into all kinds of areas. Of course, in police departments, it's very important, but you see it in other areas too. Obviously, drone operators in the military. It's not just PTSD that they have, which is a terrible problem, but they also have a great deal of moral injury going along with their job.
Yeah, I wonder too, Dr. Mann, even looking at it with frontline workers, right? At Columbia and other hospitals, the idea of, do you think there's overlap with moral injury in that sense of PTSD, in the sense of trying to provide help to patients in the COVID world and maybe not having enough services or supplies or stuff like that? Do you think there's a connection there as well?
Definitely, Jeff. That's a very astute question. The COVID pandemic created a war-like situation for healthcare workers, which we normally wouldn't experience in civilian life, except perhaps for very unusual catastrophes. But 9/11 was nothing for the healthcare worker. It was huge for the first responders, but those of us in the hospitals who are waiting for floods of patients, that never happened. Well, boy, we really got floods of patients back in April and May in New York City. It was unbelievable, and we were surrounded by death and catastrophes and what went on in ICUs. It was just definitely a war-like situation. And then it's more recently in California, where resources outstripped what was the need. And so patients were dying in emergency rooms because we didn't have enough oxygen cylinders, and all kinds of things were going on. We lacked experience, but we had, and in some countries, and they actually wouldn't send people over the age of 60 or 65 to a hospital. They just let them die at home. So people had to make those choices and decisions, and people had to live with those circumstances. There was a huge amount of moral injury that flowed into and PTSD that affected healthcare workers in COVID-19.
Yeah, thank you, Dr. Mann. As we transition over to you, Chief Mcvay, I know I have hundreds of questions I want to keep asking all of you, but I'll tighten it to make sure the audience gets more in there. But Chief, honestly, from your perspective and your vast experience in policing, nearly 30 years, and I guess the first thing I'll say to you, and jumping on from what Dr. Mann just ended with, one of the most awful negative things that somebody could say in that setting to a frontline worker or to policing And we look at what Dr. Kamcar, Katy shared, it's organizational stressors is a chief or supervisor saying to the police, hey, it's what we signed up for. Or, man up if you're a man or woman even, which is awful in itself. Don't worry, Sherry, I'm coming over to you soon too. And I don't know, it's just in your role and your capacity as the chief and even being head of the association, what's your take and perspective on moral injury? Before I throw it to you, I see there's some questions. We're definitely going to get to them, especially how do we account for it and how do we handle it as far as training and stuff. But sorry, Chief.
Well, no, thanks, Jeff. And I think you answered your own question. I mean, I think you could have asked that question a different way, what not to say. And I think you covered that. And I think Sherry's validating that with shakes her head. But I mean, it's a good point, right? And, I just want to go back to what both Dr. Mann and Katy had said is we're in a different era. To know better is to do better. And the reality is we didn't know this. So for us, a lot of things as a traditional police organization, we thought were PTSD or actually moral injury. But I think when you actually talk about this, we're talking about resilience. So when I saw some of the questions there in regarding to training, can you train for this? Absolutely you can. There's all kinds of training to build resilience. But the piece that we've been really focusing on working in is an early intervention system. Because it's generally, for what we're seeing here, it's not one incident, right? It's the gradual buildup. And just like that rubber band is being pulled and eventually it snaps. But if you have an intervention using some of the data and some of the methodologies that both the doctors on the line can give us, then I think we actually can get ahead of this and get somebody that intervention or that contact with a positive manner where it's welcoming and the ability to show it's actually a strength to talk. It's not a weakness to talk. And then to push that down through your organization and make it the responsibility of the chief's office. I mean, I think at the end of the day, if we don't look after our people, what is the role of the chief? And sometimes that gets lost by, trying to make sure that the old language that I've heard many times over is keep the powder dry. No, this is about our people. And if we know what's going on, then we have to build those intervention systems starting in training. But if we think we're just going to do this in recruit training, that's not enough. This is training, reconfirming, affirming, highlighting successes, and it goes on and eventually it becomes the norm. So I think we're in a good place of what we know now compared to what we've done. Now it's really about leadership to get it done. And quite frankly, I think that's one of my primary roles as a chief is to make sure, how can my people look after others if we're not looking after them? And it doesn't need to be any more complicated than that.
Yeah, and Chief, the amount of messages in the chat box and people are sending them in privately through the Q&A, it's like we kind of laughed about like the examples I gave, but I can vouch for it from what I hear from people firsthand across the world and country. Bosses, but also fellow cops do say that frequently. It's, hey, it's what we signed up for. And this is where I'd say to you too, is the saying itself isn't wrong, because in part it is true. It's what we signed up for. And again, Dr. Mann, medical professional staff as well, we did sign up for this, but to say it in such a dehumanizing, disconnecting way, it's the purpose of saying it and the impact that it has. I don't, Chief, if you don't mind me pressing you, just from your personal perspective, how do you handle that when you find out an officer's been involved? And when I say officer of all ranks, what do you try to do personally, being the number one person in your agency?
Those are things that right now are flagged to me, each and every one of them. And I try to follow it up with a phone call that doesn't talk about the incidents. How are you doing? What do you need? What is the chief of police? What can I actually give you? And I mean, I got 3,000 employees. So is that easy? No, but this, when you get to the major things, these aren't that common. I mean, they're common enough, but I think that's one of my main responsibilities, to at least let them know we want to help them. And with that, we've got teams in place that can follow it up. But Jeff, you've been in policing for a while now. How many times have we heard I bled for this organization and this is how I get treated? Yeah. And yet we haven't done anything, right? So, I mean, there's a responsibility for us to look at this different. And I think one of the trigger points is when people forget why they're doing the job and it becomes what they're doing, we've lost sight of what's happening. What they're doing is being a police officer. Why they're doing it is not about that. It's generally they sign up, want to help their community, want to make a difference. And when we start to lose that, and that's very easily recognizable, that needs to be trained into our sergeants and our staff sergeants to recognize, to have those one-on-one conversations on a regular basis, not to do performance management, check in, how are you doing? You know, like any normal human being would do. And we're in the process now of freeing up that time, because that's job number one. Is it a shift? Absolutely. Is it a necessary shift? Absolutely. Can we get there? Do we need to make it complicated? No, because some of it is just basic chat.
Well, right. And you said so many things. It's that sense of, and I'm going to come to you, Sherry, in a second, and maybe after her, back to you, Katy. That idea of, in the world of resilience, what you said there, Chief, is that idea of sense of purpose. And when that sense of purpose seems to get lost, then what replaces it almost that moral injury. And then it's sort of losing that sense of personal direction, but also the sense of direction of what is your agency trying to do and what differences can it make, and those questions that then can turn into ruminating and just churning over and over and over. And what I will say to you, Chief, a response to like any chiefs on the line or any officers, in the sense of, do we have time for this, to include it in training beyond just recruits, beyond just when you become a supervisor? My question to everybody else is, if we don't have time, what's taking priority over that? And it needs to be continual, right?
Well, 100%. I mean, we control training. We have the ability to change training. And at the end of the day, little things like that. I mean, training and policing is going to change. And we saw what's happened over the last year: COVID, economy, George Floyd, let's add it all up. All those things are going to create moral injury. COVID long play is going to be more moral injury, because members that were actually good police members are being compared to people that weren't good police officers, and they're being questioned by their own families. So we better get it in training. And if we're not getting it in training, we're going to deal with a bigger problem later on, because a lot of this stuff, it's like anything else, is if we know somebody's headed to the justice system, why do we wait? Why don't we try to intervene and keep them out of it? And actually, that's a double count, because now you've actually, old terms is turn a tax user into a taxpayer, but more importantly, turn a human being into getting help to be self-sufficient. I mean, there's so many of these things that go hand in hand. But your point is we got to think differently. And those that can, I think it's going to be a primary requisite for police leadership into the future. Yeah,
spot on. Thank you, Chief. Transitioning over to you, Sherry, and thank you for your patience. One thing that the Chief said, and I know you're very much involved in, is, and by the way, Chief, I don't know if you saw it in the chat box, a lot of people seem to be wanting to apply to your agency now based on your comments there. So look for a lot of applications coming in. Making those personal phone calls. And I know, Sherry, with the work that you've done and the work that we've done together, that's the hallmark of what he said, what he does, of a peer support member, right? We won't talk about the issue. We're just going to talk to you like a human being. Surprise, surprise, right? From your really important position as the National Director of Wellness Services with the Fraternal Order of Police, and for everybody that doesn't know, the recording of this, when it's taking place, she's down in Nashville at the moment having a national summit on police officer wellness that the FOP is organizing. What is it that you think can be done? And more important, I guess equally important, but slightly different, what are you guys doing as such a leadership organization as the FOP? So please, Sherry.
Thanks, Jeff, for that question. And I just want to real quickly, Dr. Kamcar, great informative presentation. And Chief, I wish that every leader had the courage and the mindset that you do, because that's really what's needed. You know, the example at the top is really what's needed to change the culture, which is a big part of what we're doing in the FOP. And as we talk about moral injury, I'm sitting here thinking of my police experience, and we can certainly recognize the times that moral injury is tied to PTSD. I can think of traumatic episodes where I felt some sort of moral injury and it was tied to a trauma, but I also think of simple scenarios where I felt that there was moral injury that I confronted. And I'll give you an example. There was a circumstance when I was an active police officer where I was called to a scene to arrest a person who was mentally disabled. And so, He, I think, didn't have a full understanding of, what he had done. He had committed a minor physical assault, and the person who was calling was working with him, was a care worker working with him, but was insistent that he be arrested. And so I had no choice. It was the law. He was arrested. I didn't have any discretion in that it was a physical assault. And so when it came to court, I felt that it wasn't court and jail were not the right place for this individual. He needed different services than court and jail. And so I personally went to court and appeared on his behalf to find different services for him, because that bothered me. It just wasn't right. And so, I saw some questions in the chat about, police conduct and how does moral injury tie to police conduct and bias and things like that. And unfortunately, in the world of law enforcement, everything is not black and white. We sometimes want to put things in boxes. It's, it's black or white, but there's a lot of gray there. And we have to, be able to have the courage, like the chief, to navigate those situations. And for me, that comes back to being a human being, to not only each other, our coworkers, but those that we're dealing with in the public, to relate to members of the public as human beings, to navigate those gray areas. So back to what you asked, Jeff, one thing that's a key priority for us in the wellness division is to keep wellness in the forefront of the conversation. And so, police are police. We don't always want to talk about things that are, related to mental health. And so I say, is wellness talking about mental health every day? No, it's not just mental health. It's physical wellness, financial wellness, family wellness, exercise, diet. It's all of those things. And so we want to constantly give positive messaging to our folks about different facets of wellness, no matter what it is, to keep that as part of the conversation, because what that does is it erases some of that stigma, makes us more resilient, to be able to open up a conversation about moral injury, whether it's that simple scenario, like something that's more tied to a trauma, to open up that conversation gives us an opportunity to talk about it. And I'll point you to something I read just yesterday. A USA Today article came out yesterday, which I spoke to the journalist about that was doing the story. And the point of the story is that the officers that were at the Capitol incident at the U.S. Capitol, one of them spoke out and said that they did not feel as officers equipped to deal with what they were dealing with. Every single one of those police officers wanted to do the best job that they could and tried to do the very best job that they could, but felt that they didn't have the support or the preparation from their administration. And that sort of thing could create tremendous moral injury, which is the sort of thing we have to get in front of.
Excellent. Thank you. I appreciate that. I'm going to throw it over to Dr. Katy Kamcar and Dr. John Mann, both of you, but I guess Dr. Kamcar, if you want to start first. I was trying to send you a message saying I was going to ask you this question, so you don't have time to prepare for your answer. But we look at organizational and we talk about culture. Absolutely can contribute to this, but also let's bring it back for self-resiliency though. What can the individual officer do? And what are some evidence-based practices? And I think Sherry was just alluding to some of that as well. But what Dr. Kamcar, first for you is, if an officer starts to experience this, what can they do to take care of themselves? Because I'm a very big adamant supporter of personal resilience, also organizational, but also the individual can do things to take care of themselves. So Dr. Kamcar, first you, and then Dr. Mann, I'll throw it to you.
Thank you very much for that. And so again, I always like to keep in mind the prevention continuum of care, what we can do at an organizational level and also at individual worker level. So always, I always want to keep that in mind. I think that we always want to appreciate, and again, I'm a clinician, so this is the importance of a holistic approach to care, a whole person management approach, and then also a comprehensive workplace management approach. So here we touch based on, in terms of a healthy organizational culture. Secondly, we talked about identifying, especially modifiable risk factors so that we can work on reducing them at, again, individual organizational level. And third, identifying and building protective factors, again, at individual and organizational levels. protective factors that target directly the risk factors. If my arm is bleeding right now, and someone says to me, oh, Katy, here's a beautiful television set that I got you, you're gonna enjoy it. That's wonderful. We can call that a protective factor, but it's not gonna address the bleeding. So we wanna make sure whatever preventative strategy or protective factors are contributing here to resiliency, to post-traumatic growth, and to our overall health and well-being.
Can you give an example first? Can you just super briefly explain in case people aren't familiar
with? Yeah. So for example, if you want specifically about, so once again, whatever we do individually is interactive with organizational, but specific ones, we know compassion satisfaction. So compassion satisfaction is the contentment from doing our work well and helping others. It's a key protective factor that, yes, that does buffer against moral injury and also compassion fatigue and the burnout. And I always say we need to protect our protective factors, because what we have also found is that compassion satisfaction in policing is actually much lower than in general population. So we always want to protect and build our protective factors. So yes, compassion satisfaction, how can we build it? Is number one, focusing on the meaning and the positives and the purpose of my work. Second of all, how helping others helps to contribute to my personal growth, my psychological growth. Third of all, appreciating our achievement, our hard work, regardless of the outcome. So important. We don't have control at all times over the horrendous outcomes, traumatic events that could happen, but we still want to appreciate it. Self-compassion, another very important protective factor. Self-compassion, self-kindness, that is included in self-kindness, as part of the self-compassion. So viewing ourselves and looking at ourselves in a humanistic way, very important. And again, continuously seeking support and variety of other strategies to regulate emotions and again, building our health and the well-being. But I would say it's the compassion, satisfaction, and self-compassion, again, among many other ones that are key protective factors, at least individual level.
Yeah, absolutely. Thank you. And Dr. Mann, right before I throw it to you, what I'm thinking, I hope everyone else is doing the same thing of trying to come up with ideas. I think of gratitude practices and the idea of self-compassion. Treat yourself the same way you treat your partner, the same way you treat your family members. And for anybody, I think we're past that point, Chief, too, of people saying this is soft or not for policing. I think we're past that point of saying this is hardcore policing, it's hardcore resilience, and self-compassion is a word that needs to be used more. And my experiences are people don't laugh and giggle about it, especially the senior cops are like, yeah, you're absolutely right. But Dr. Mann, how about from your perspective, any specific things an individual can do?
Yes, so I guess I would agree with everything that's been said so far, but I think first of all, there's what's the organization doing to protect the individual, and then what is the individual able to do to protect themselves and improve resilience. So we learned from Iraq and Afghanistan and so on that you can take the best trained soldiers, but if you expose them with repeated tours of duty and not enough dwell time in between, you're going to gradually break down most of your unit. It's just a matter of time. So there is a wear and tear effect that's very important, and that we have to be cognizant of. And then the degree of preparation. We heard from Sherry about the Capitol Police. Well, when you saw those riots going on, you wonder, were they trained to deal with this kind of adversity, where they were completely outnumbered, and the violence of the individuals they were confronting was unprecedented, and some of them were in full battle gear. Excuse me. So some genius just turned on the air conditioning in my office. You wonder how well prepared they are. So self-preparation is terribly important. The organization providing support, preparation, and adequate training is very important. This empowers people. They have more choices, more options, more sense of capacity, more capability of problem solving. If you think about it, to some degree, it's a matter of managing anxiety in the individual. There is this concept of what's called the Yerkes Yerkes-Dodson curve, which is as your anxiety level rises, your performance increases. But as your anxiety level gets too high, your performance begins to decrease. So we try to balance capacity to deal with a situation as a way of controlling the anxiety that's flooding the person in that crisis. So yes, you can do a lot of things to try and train and improve yourself, and all of the things that Jeff and others have talked about, how to look after yourself, how to treat yourself better, and so on. But also talking to your buddies, you can get a better perspective on how well your organization is really supporting you, because sometimes we lose perspective on that boundary. What is, I wasn't trained properly. What is the organization doing to me that is too much and not fair, versus what I can control? And by talking to your buddies, you kind of get a sense of that balance, and your sense of self-responsibility for your own distress and ability to cope gets a better perspective. So I think that that's a big part of this.
Yeah, absolutely. I like how you described that, where stress and anxiety aren't wrong and they're not bad. It's just, do they get to a point where it's no longer healthy and helping you perform in that moment and then going on? One question I want to pose to the whole panel, and this is for me when looking at helping put this together, that I wanted to bring up in a way, Dr. Kamcar and everybody else, how I've been looking at the idea of moral injury in the sense of the impact that it can have on the police workforce globally, specifically the current climate. And that's why, for the people that do know me personally, I don't mince words, and I like to be straight to the point of looking at moral injury in the anti-police rhetoric that's been rampant, and also having to police in the COVID-19 world of being asked to either potentially, or some police agencies having to try to police people wearing masks or not wearing masks, and the impact that it has. From what I've looked from my own perspective, the dehumanization of police has been awful, absolutely awful. And I call that, in my definition, Dr. Kamcar, the impact of moral injury that can have. And I personally like to say the narrative can include many different versions, and it has to include what's happening to police officers of wanting to help. By far, the great majority of police are doing a great job every single day. And then, for example, to go to quote unquote a peaceful protest and have god awful things said to them that are described as peaceful, but they're anything but peaceful. And I'll throw it out there to any of you if you want to jump in, but there is no way this webinar was ending without me sharing that and actually acknowledging it to my brothers and sisters out there to say it is awful. And it's normal to be bothered by that. But then it goes back to what Dr. Mann and Dr. Kamcar said as well. Make sure you're checking in with yourself and with your brothers and sisters to make sure you're handling it in a positive way. Because, Chief, it is what we signed up for, but it doesn't make it right either. So I will stop and throw it to any of you if you want to jump in and share any comments on that.
Jeff, I'll jump in there. But, Chief, if you want to go first, go right ahead.
Oh, you go ahead, Sherry. I'll follow you.
Okay, so now constantly, one thing that we try to do in the FOP is we ask our membership these questions, right? Because if we're developing programs for law enforcement, we want to ask the users what they need and what they want. So we have survey research ongoing right now within the FOP about the impacts of the pandemic and about the impacts of the protests on not only their well-being, but what sorts of things. So what we know is the two top key stressors coming from policing during this time is, one, fear of harm to their families from the pandemic, from carrying it home, and two, enforcement of restrictions on the public. So both of those pull in a key of moral injury, right? For most people, their family is the most dear and precious thing to them. And so, they're going out doing a job trying to protect other people, but at the same time, increasing the potential that they're going to harm the thing that's still most dear to them. And they want to be able to do the good thing they want to do in their work, but also not harm the thing most important to them. And so, it's a struggle internally. And then with enforcing restrictions on the public, oftentimes these officers have been called to enforce things that are not really law. And, they may not agree with restricting those personal freedoms. And then again, that presents an internal conflict for the individual officer, and that's stressful.
Sherry, somebody asked, sorry, Chief, one quick sec. When and where will that data be provided once it's published on the survey?
Yeah, so it's still ongoing right now. So I'm not exactly sure what, where and when we'll publish it, but it's gonna be out there.
Great. Thank you, Chief. I don't know if you wanted to jump in.
Yeah, Jeff, I mean, it's the perfect storm, right?
Yeah.
Our economy's taken a hit. We've got the Minneapolis incident that it's an attack on the uniform. We've got COVID. So, I mean, there's a few things here, first and foremost. I think police leadership have two things. We have our voice of our authority and we have our voice of our influence. And quite frankly, when you mention rhetoric, I mean, we got to remember, first of all, is this social media animal is driving some of this, if not a lot of it. So we got to figure out how we can better communicate. So first and foremost, we have to build a structure like we talked about. For us, it's, making sure that we got an early recognition system designed into a reintegration program. So that's after. But in regards to that, is we got to change the channel on this discussion, because your point is it's not factual, but you can't do that with just stating opinions. So we put a commitment to action team, went right into the heart of all of our communities, and we started to actually have meetings. They're Zoom, but they're effective. And what we're seeing right away is, even in the heart of the beast, if you want to say it, or the belly of the beast, 70% of it's positive, 30% of it's negative, but at least we can actually tell, here's what we do, call it commitment to action, here's some things we change. So first and foremost, we as organizations, police organizations, got to realize there are some things we need to change. And I think everybody gets that. I think we all get that. But at the second time is when we get the rhetoric, just send a social worker, send this, and yet we can't even deal with masks. In my last job as a deputy minister in government, you got to start following the money. Social work is already funded 5 to 1 to 7 to 1 to police. The whole social fiber and the social impact, if you look at it from working in agencies together, is dysfunctional, and we wear the brunt of it. So now we need to use our voice of influence through factual data to actually change that. We just did a big research, give you numbers because they don't really mean anything. The spend in this in my city right now is $7.5 billion a year. The police budget is $462 million. We're a little over 6%. We're focusing on the wrong end of the stick. Not saying we don't need to change, but the point that I'm trying to make is, there's an old saying that's been around for a long time, never waste a good crisis. We have to change the channel to get the changes we need to make a difference for people. And if we put the people in the center and we start talking about this differently and protect our own people at the same time, then we can progress. If we just get there and we start responding and it's not well thought out, we're adding things right now, in my opinion, and that and $1.25 gets you a good cup of coffee if you're lucky. But the reality is we're adding things that aren't going to make a difference to the actual experience. And that's where we run into danger. And that's why we, as an apolitical organization, have to stand behind and start to write some of our own script and get our information out. And it's going to mean changing the way we communicate. If somebody told me that I had to be on 6 podcasts, before this all started, I probably didn't even know what a podcast is. But you know what? Traditional media are going to have their own way. But the people that are in this organization and that are creating some of this, they don't listen to the traditional media. So we got to defend our members. We got to protect our members. We got to make sure they're safe. We got to recognize we got to change some of the things that we need to change, but we got to start carrying the torch of change and using our voice of influence, because we're not elected. We're leadership in an organization. We're the only thing in all the other organizations that are local, and we need to bring the local voices in, because it's still the far majority that support it, but it's hard when you keep hearing the same people over and over, and you get attacked over and over and over on social media. And sometimes we just got to change those channels.
Absolutely, Chief. And it's that idea of perspective, and knowing that, I think, is important to point out. I realize we're hitting the 12-hour mark, and we'll just go a couple minutes over. I'm going to throw back to our presenter and panelists. There's an announcement going on here. I'm sure you can still hear me. I'll lean a little bit closer. Just last closing comments, and we'll first start off with, what order did I have? Dr. Mann, we'll send it to you first, and then Sherry, Chief, and Dr. Kamcar.
Please be mindful.
Yeah, I would like to just emphasize the sort of society, the organization, the police department, and the individual. All of these things play a different role. All of them have contributed to some of the things that we've heard in our presentations today. The issue of managing demonstrations in different cities were pushed in one direction and another direction because society itself couldn't decide what it wanted. And so the one side thought the police are doing the wrong thing, and the other side thought the police are doing a great job. And you hear most of the noise from the group with the complaints. So that's very stressful. And then you've got each police department has its own style and culture and so on and so forth. And that's where individual police officers speaking to each other can get a perspective. Is it me and what I'm doing that's not right, or the problem, or is the police department, got to think of different ways of handling things at an organizational level? And then there are things that the individual can do, which are important. And the individual has another important right, which we haven't said a lot about, and that is the right to confidential, competent care. And something like that has to be in place, especially in police departments where, that comment you made at the beginning, Jeff, man up, a very problematic statement, but it basically means suck it up no matter what. And that is not the answer in 2021.
Excellent. Thank you, Dr. Mann. Sherry?
Yeah, Dr. Mann mentioned competent care, and that's one thing we're doing in the FOP is we're creating a nationwide directory of culturally competent services for law enforcement. So, that's absolutely key. And, everything from peer support all the way up to, individual cleanicians, inpatient treatment facilities, anything that officer needs that is culturally competent. Another thing I want to say is that, we're all here to make sure that our officers stay well and to help them. And so let us not forget what that requires. It requires these conversations. And, if we are an administrator or we are members of academia, let's not forget to go to the source, go and talk to the office, ask them what they need, make an environment so that they're comfortable saying what it is they need and what they're experiencing, and then listen to that, because that's the best way we're going to develop things that are actually going to help.
Excellent. Thank you, Sherry. Chief?
Yeah, thanks. And first I'd start off with thanking Dr. Kamcar again for a great presentation. And every time we talk a lot, and every time I always pick up some things, but I think first and foremost, Jeff, what I'd recommend is we need to share more of these experiences, because if we can take a little bit from each other, we're going to be better. There's another piece of this that we really didn't talk about that I think is critical to this being successful. In most policing agencies, it's a triangle. It's a police commission, a police union, and police leadership. They better be on the same page, because this is about our people. There's things that we should fight about, but not our people. And then the other thing is, I think you got to focus on where the puck or where the ball is going. Pay attention to law enforcement, public health as an entity. Public health has the ability to engineer, police has the ability to reverse engineer, and we need to focus on things that work. If you think about this, Buffett was a great investor because he was doing things others weren't. Great athletes know where the puck or the ball is going to be, and that's where they are. Stop following the herd and thinking that we're just going to make this about let's put body cameras on everybody and everything's solved. That's not going to solve anything. This is use the evidence, use the smart people, take the best practices, and let's pilot, try, adjust, and go on, because losing is not an option. It's about our people.
Thank you, Chief. Fantastic. And Dr. Kamcar?
Thank you so much to all. As we discuss, moral injury is a loss injury. It's a grief. And it's a disruption in trust in our moral values and moral beliefs and standards. And as we have talked about, yes, we do need to address it from early on and throughout and repeatedly, and have this opportunity to engage in dialogues where we feel supported and we are able to address any inner conflict that might occur. While moral injury is not a diagnosis, it is a significant mental health issue, as we just talked about. Finally here, I would like to finish reading with, if I can, with my favorite quote. It's just a one sentence, and it's by Brené Brown. You might have a clue, you might relate to that once I finish reading it. It turns out that trust is in fact earned in the smallest of moments. It is earned not through heroic deeds or even highly visible actions, but through paying attention, listening, and gestures of genuine care and connection. And so to all our police and law enforcement who are listening to us, thank you so much, for heart to heart, for who you are and all you do. Thank you.
Excellent. Thank you very much, Dr. Kamcar. Thank you for your presentation. To our incredible panelists, thank you for everybody that signed on live. I appreciate you taking the time today to participate. We had so many questions that we didn't quite get to all of them. I apologize, but if you notice the format of this, we only went 25 minutes of presentation. The rest of the webinar was dedicated to discussion, and we're going to have more of these. And the whole idea of just to sort of encapsulate what everybody just shared was, the note I wrote is dig deeper, learn more about these topics. When was the last time we had a conversation on moral injury? Dig deeper, make more connections between the police and researchers and academia. There's so much more that needs to be done, but let's make sure everything that's being done is evidence-based and not just at the fly of the hat. And the last thing I'll say is, and I say this not just to the police on here, but to everybody, don't forget we're people. As someone just said, we're humans. Before we put on that uniform, whether it's a doctor's jacket or nurse's outfit or police or EMS or firefighter, we are human beings. We deserve positive mental health, evidence-based strategies to do it every single day, because we did sign up to help people. Let's make sure the first person we're helping is ourselves. And on that note, we look forward to seeing all of you at our next webinar. For the time being, be well, be safe. Take care, everyone.